Hi everyone, so I wanted to share a little bit of information about the upcoming HCNE, so it's the Headache Cooperative of New England Winter Symposium, so it's a scientific headache symposium that will occur very close by in Greenwich this Friday and this Saturday. And I'm very grateful and honored to be invited to speak on Saturday on the education in headache to healthcare professionals in Africa called EHHPA. So there's 2.9 billion of people affected by headache disorders in the world, and the prevalence and the disability of headache disorder is similar between high, middle and low income countries and between Africa and the rest of the world. The difference is that there are even more barriers to headache care in Africa. There is 0.01 neurologists per 100,000 inhabitants in Africa. When the World Health Organization and Lifting the Burden surveyed 101 countries of the world for the Atlas of Headache Disorder, the number one thing that was ranked to help the care of people living with headache disorder was professional education. That's how EHHPA, Education in Headache to Healthcare Professionals in Africa, started as a collaboration between GPAC, the Global Patient Advocacy for Headache, the World Federation of Neurology, WFN, the African Academy of Neurology, AFN, and the International Headache Society. The different partnerships, collaboration, priorities have changed over the year, but we have kept EHHPA for 5 years. I've been involved in the planning and organization of it since the first year in 2021, and I organized it in 2025. Happy to report the result. We went from 551 participants in 2021 to more than 1,400 live participants in 2025 with great results. When asking before and after the conference confidence in differentiating migraine from headache disorder, it went from 45% of participants to 95% of participants. And when asking about their confidence in identifying cluster, it went from 37% to 95%, which is great because cluster it tends to be even more underdiagnosed. And then 97% of people reported improvement in the headache management skills as a result of the conference. So happy to share this result and grateful to HCNE for inviting me to talk about the lesson learned from 5 years of the EHHPA.